Have you noticed this happening to you? You go to bed tired, but instead of resting, you wake up again and again through the night to use the bathroom 2 times, 3 times, sometimes more. And by morning, you don't feel refreshed. You feel drained, foggy, weaker than you used to be. Now here's the part most people don't realize, and this is critical. Frequent nighttime urination isn't just an annoying sign of aging. In many older adults, it's one of the earliest warning signals that the kidneys are under stress, quietly struggling, long before a diagnosis ever appears on a lab report. I'm Dr. Mark Ellis, and I need to be very clear with you. When creatinine begins to creep up even slightly, and sleep keeps breaking apart night after night, that combination is not harmless. It can signal a chain reaction, poor recovery worsening kidney strain, and a faster slide toward chronic kidney decline if nothing changes. But here's the hope, and this is the reason you should keep watching. In this video, I'm going to show you how choosing just 1 out of 6 specific fruits eaten the right way and at the right time may help calm kidney stress, support healthier creatinine levels, and reduce nighttime bathroom trips without forcing your kidneys to work harder. And what surprises most of my patients is this: it's not about eating more. It's about eating smarter in a way that helps your kidneys finally rest. When we talk about protecting aging kidneys, most people immediately think about cutting protein, avoiding potassium, or drinking more water. But what almost no one talks about is inflammation, the quiet, slow-burning kind that damages kidney tissue long before symptoms become obvious. I remember a 68-year-old patient who came to see me after months of doing everything right. She avoided fruit, limited her meals, followed strict online advice, yet her creatinine kept creeping up. She wasn't in kidney failure, but her labs refused to improve. And more importantly, she felt exhausted all the time. What her kidneys didn't need was more restriction. What they needed was relief. This is where blueberries come in. Blueberries are rich in anthocyanins, powerful antioxidant compounds that help reduce oxidative stress in the tiny blood vessels of the kidneys. And this matters more than most people realize. Studies have shown that chronic low-grade inflammation accelerates kidney aging by damaging the filtration units even when creatinine rises slowly and quietly. When inflammation stays unchecked, the kidneys are forced to work harder just to maintain balance. Here's the key point: most people miss blueberries don't stimulate kidney filtration. They don't push the kidneys to work harder. Instead, they calm the environment around the kidneys, allowing them to function with less strain. That's a critical distinction, especially for older adults. In fact, research published in nutrition and renal health journals has linked higher intake of anthocyanin-rich fruits with improved vascular flexibility and reduced markers of oxidative damage, both of which directly affect how gently or aggressively the kidneys have to filter blood. Less inflammation means less microscopic damage over time, and less damage means creatinine often stabilizes instead of silently climbing year after year. Many patients notice something subtle before any lab value changes. They feel less heavy, less inflamed, and more stable throughout the day. That's often the first sign the kidneys are no longer under constant stress. But here's where things get even more interesting and more important, because calming inflammation is only the first step. Even if inflammation improves, the kidneys still can't recover if they aren't receiving enough blood and oxygen to heal properly. And that brings us to the next fruit one that supports kidney recovery in a completely different way. Because knowing this alone isn't enough. There's another factor that may be even more dangerous if you ignore it. If inflammation is the fire quietly damaging aging kidneys, then poor blood flow is the reason that fire never truly goes out. And this is where many kidney-friendly plans quietly fail. They calm the inflammation, but they forget one thing: the kidneys can't heal if they aren't being fed properly. I once worked with a 72-year-old man whose creatinine numbers looked borderline acceptable, yet he felt constantly weak, cold, and drained. He wasn't in pain, he wasn't swollen, but his kidneys were struggling in a different way. They were undersupplied. His blood simply wasn't reaching the kidneys efficiently enough to support repair. This is where mulberries make a difference. Mulberries have long been associated with improved microcirculation, the tiny blood vessels that deliver oxygen and nutrients to organs like the kidneys. In older adults, these microvessels often stiffen or narrow with age, reducing renal perfusion even before obvious kidney failure develops. When that happens, creatinine may rise slowly but steadily because the kidneys are forced to filter under poor conditions. Scientific data supports this mechanism. Reduced renal blood flow has been shown to correlate strongly with declining kidney function in aging populations, even when protein intake and hydration are carefully controlled. Without adequate circulation, the kidneys are essentially asked to do delicate filtration work while starving for oxygen. Here's the crucial point most people overlook. Mulberries don't stimulate the kidneys. They don't push filtration rates or overload the system. Instead, they support the delivery system, helping blood reach the kidneys more evenly so filtration can happen with less resistance and less tissue strain. Many patients notice a subtle but important shift after consistent intake, better daytime energy, warmer extremities, and a sense that their body is no longer constantly fighting itself. These changes often appear before creatinine numbers improve, and that's exactly how true kidney support usually works. But even when inflammation calms and blood flow improves, there's still a third obstacle that quietly sabotages kidney recovery in millions of older adults, especially at night. Because knowing this alone still isn't enough. There's another factor that may be even more dangerous if you ignore it. By this point, you might think you've identified the enemy. You've cut back, you're more careful, you believe you're protecting your kidneys. But here's the uncomfortable truth. Most kidney damage doesn't come from what people add to their diet. It comes from what they unknowingly do every single day, believing it's harmless. I once spoke with a man in his early 60s. He didn't smoke. He didn't drink. He followed what he thought was a clean routine: light dinners, fruit at night, herbal teas before bed. Yet his lab results kept getting worse. Creatinine slowly climbed. Nighttime urination disrupted his sleep. He told me, "I'm doing everything right." So why is this happening? The answer wasn't dramatic. It was subtle. Chronic dehydration at the wrong times, repeated blood sugar spikes late in the evening, and a sleep cycle that never allowed his kidneys to recover. Science backs this up. Studies show that kidney filtration follows a circadian rhythm. At night, your kidneys are supposed to slow down, repair microdamage, and rebalance electrolytes. But late-night eating excessive fluids before bed or high fructose foods can force the kidneys to stay in work mode when they should be resting. One large clinical review found that disrupted sleep and nocturia are associated with faster kidney function decline independent of age or baseline disease. So what's the solution? Not extreme diets, not cutting everything out. The real fix is timing and structure. First, shift the heaviest foods earlier in the day when insulin sensitivity is higher and kidneys handle filtration more efficiently. Second, hydrate strategically enough during daylight hours, but taper fluids 2 to 3 hours before sleep. Third, choose kidney-friendly foods at night that are low in glycemic load and easy to process, not healthy foods that quietly overload the system. Most people focus on what they eat. Very few pay attention to when and why, and that's why they keep missing the real cause. But knowing this still isn't enough, because there's one more hidden factor that can silently accelerate kidney damage even faster. So after fixing timing, hydration, and sleep, many people finally feel relieved. They think, okay, now I'm safe. But this is where the most dangerous mistake quietly slips in, because the next threat to your kidneys doesn't come from food at all. It comes from what people take without a second thought. I remember a woman in her late 50s who did everything right. She adjusted her meals, fixed her sleep, drank water earlier in the day. Yet her kidney numbers still declined. When we looked deeper, the pattern became obvious. Every headache, she took painkillers. Joint pain, another pill. Just over the counter, she said. They're safe. Right. Here's the science most people never hear. Common pain relievers like NSAIDs, ibuprofen, naproxen reduce blood flow to the kidneys. In healthy adults, this might cause temporary stress. But in people over 50 or anyone with early kidney decline, repeated use can permanently damage filtration units. Studies estimate that long-term NSAID use increases the risk of chronic kidney disease by up to 26% even at non-prescription doses. And it doesn't stop there. Many natural supplements, high-dose vitamin C, certain herbal teas, protein powders can quietly increase oxalate load or nitrogen waste, forcing your kidneys to work harder every single day. The danger isn't one pill, it's the accumulation. So what's the smarter approach? First, treat pain as a signal, not something to silence daily. Explore non-drug options. First, movement-targeted stretching, magnesium under medical guidance. Second, if medication is necessary, use the lowest effective dose. and avoid stacking multiple kidney-stressing substances together. Third, be cautious with supplements marketed as detox or anti-aging. If your kidneys are already struggling, they don't need extra work disguised as health. Most people obsess over diet. Some learn about sleep and timing. Very few ever question what's sitting in their medicine cabinet, and that's why kidney damage keeps progressing quietly, even in people who think they're doing everything right. But knowing this still isn't enough, because there is one final overlooked factor that can accelerate kidney decline faster than all the others combined. After medication and supplements, most people assume they've uncovered all the hidden dangers. But here's the uncomfortable truth. The next threat doesn't come from what you take. It comes from what you ignore every single day. I once met a man in his early 60s whose kidney function declined steadily, even though he ate clean, avoided painkillers, and followed every online kidney tip. His labs didn't make sense until we looked at one habit no one had ever asked him about: blood pressure spikes at night. Here's the science. Your kidneys depend on stable blood pressure to filter waste safely. When blood pressure rises, especially during sleep, it silently damages the tiny blood vessels inside the kidneys. Research shows that uncontrolled or poorly timed hypertension is responsible for up to 1/3 of all chronic kidney disease progression, yet many patients never feel it happening. No pain, no warning, just slow, irreversible damage. And here's where it gets worse. Many people measure blood pressure only once in the morning or at a clinic. But studies using 24-hour monitoring reveal something shocking. Nearly 40% of adults have masked hypertension, meaning their blood pressure looks normal during the day but spikes dangerously at night. This is when kidneys are supposed to rest and repair, not fight against pressure. So what can actually protect your kidneys here? First, timing matters. Taking blood pressure medication in the evening, not just the morning, has been shown to significantly reduce nighttime kidney stress in some patients. Second, salt sensitivity increases with age. Even moderate salt intake can raise nighttime blood pressure without obvious symptoms. Third, poor sleep quality, especially sleep apnea, can repeatedly spike blood pressure, and oxygen deprivation accelerating kidney decline. This is why some people do everything right and still lose kidney function. They're fighting visible enemies while an invisible one keeps attacking in the dark. If you've ever wondered why your creatinine keeps creeping up despite good habits, this could be the missing piece. And once this damage happens, diet alone cannot reverse it. But even understanding blood pressure and sleep isn't the final answer, because there is one last factor often dismissed as just lifestyle that can determine whether your kidneys stabilize or fail completely. After everything we've uncovered, medications, supplements, blood pressure, and sleep, you might think the danger is finally under control. But this last factor is the most underestimated of all, because it feels harmless, ordinary, and familiar. And yet it may be the single habit that decides whether your kidneys stabilize or quietly fail. I want to tell you about a woman in her late 50s who did almost everything right. She ate carefully, avoided salt, took her blood pressure meds, even walked every morning. Still, her kidney numbers kept slipping. The breakthrough didn't come from a new drug, but from one simple question: how much water do you actually drink? And when here's the science most people never hear. Chronic low-grade dehydration doesn't cause dramatic thirst, but it forces your kidneys to work harder, concentrating waste instead of flushing it out. Over time, this raises vasopressin levels, a hormone linked to faster kidney decline. Studies show that people with consistently low fluid intake have a significantly higher risk of reduced eGFR and kidney scarring, even when all other factors are controlled. But it's not just about how much you drink, it's how and what. Sugary drinks, fruit juices, and even healthy smoothies high in fructose create metabolic stress inside the kidneys. Fructose metabolism generates uric acid directly in kidney tissue, triggering inflammation and fibrosis. Research suggests that high fructose intake can accelerate kidney damage, independent of diabetes, a fact that shocks many patients. Then there's timing. Drinking too little during the day and overloading fluids at night disrupts sleep, raises nighttime blood pressure, and paradoxically worsens kidney stress. Your kidneys thrive on steady, gentle hydration, not extremes. So what actually helps? Prioritize consistent water intake earlier in the day. Replace sweetened beverages with plain water or lightly infused water. And most importantly, stop forcing detox drinks or extreme hydration trends that push kidneys into overdrive instead of supporting them. This is the quiet killer habit because it looks normal. No pain, no warning, just slow damage day after day. If there's one thing I want you to remember, it's this: protecting your kidneys isn't about doing more. It's about stopping the subtle harms you've been told are harmless. But knowing this still isn't enough, because there's one final truth about kidney survival that almost no one talks about, and it may change how you see your daily choices forever. If you've stayed with me until this moment, I want you to know something very important. Your kidneys are not failing because you're weak, careless, or doing everything wrong. Most people were simply never taught how to protect them the right way. And the fact that you're here listening already means you're taking control of your health again. Start small, one change at a time. One change: eat foods that calm your kidneys instead of forcing them to work harder. Drink water with intention, not extremes. Pay attention to sleep, blood pressure, and the quiet signals your body has been sending for years. These aren't dramatic fixes, but they're the ones that truly work, especially after 50. If this video helped you understand your kidneys, better save it. You may need to come back to it or share it with someone you care about, because kidney damage often happens silently, and knowledge shared early can change a life. And if you want to keep learning how to protect your kidneys, lower creatinine, naturally sleep better at night, and avoid dialysis for as long as possible, subscribe to this channel. Every week I share clear, science-based medical insights without fear, without confusion, so you can make decisions with confidence. Remember, this kidney decline is not a sentence. In many cases, it's a warning, and warnings give us time. With the right choices, consistency, and understanding, your kidneys can slow down, stabilize, and support you for many more years. Take care of your kidneys, and they will take care of you.